Great. Good afternoon, everyone. This is Anna Barnes with the Illinois Public Health Institute. We've been convening the Health Information Technology Learning Collaborative now for a while. So I just want to do a quick introduction here to why we're hosting this event today and introduce our speakers, primarily Elise. So I think earlier in the start of the Learning Collaborative, I know Maryland was really interested in learning about Epic Community Connect. We all know that Epic is one of the largest electronic health record vendors, and they continue among the other vendors to develop different systems for connecting and sharing data with community-based providers. So they have a new feature called Community Connect. And I'm going to read to you a little bit about Elise. So we actually connected with Elise through some partners in Hennepin County, Minnesota. She is with the Hennepin Health System, and she serves as the Epic Affiliate Program Manager with Hennepin Healthcare, a safety net health system in Minneapolis, Minnesota. She brings extensive experience in implementing and managing Epic Connect relationships. Also for the Q&A, we have Janielle Q, who is a new staff member with the AAA of Southwest Washington, which has been one of our Learning Collaborative groups. So Janielle serves as the Quality Improvement Data Coordinator for the Area Agency on Aging and Disabilities of Southwest Washington, and she previously worked for Epic Community Connect on the technical team. And so now she's leveraging that experience with her work at the AAA. So I just want to say, typically for IPHI and for the work we do with DASH&LN, we don't endorse any particular vendor or software, but because this particular one was of interest to many of you, we thought it would be helpful to hear from a user's perspective of the features and functionalities. So I'm going to leave it at that, and Elise is going to present her slides. If you have questions for her as she's going along, you can submit those in the chat, and then we'll take questions at the end. And Danielle will also be available if you have more technical questions about the functionality of Epic Community Connect to chime in as well. So thanks, everyone, and Elise, you can go ahead and get started.
Thank you. Hi, everyone. I hope you are having a great start to your Friday, and thank you all for being here. I'm just going to start with a little bit about me, and my goal for today is for you all to take away some of the best practices and lessons learned that I have gleaned over the years from my experience with Community Connect, in the hopes that whatever partnership that you're about to embark on, that you can kind of take those lessons learned and apply them, even though everyone's situation is probably going to look a little bit different. So first, I'll just say right off the bat, I'm not affiliated with Epic Connect program in any way. I did previously work for Epic from 2009 to 2013. That's where I got some of my experience, but I have no relationship with them now. So this is all just my personal experience over the years, working both for Epic and for Epic organizations. So a little bit about me. I've kind of hopped all over and landed in Minnesota. I don't know why I left Hawaii. I can't really tell you why. But these are the states that I've lived in. And if you want to go to the next slide, the next slide is the states that I've implemented Epic Community Connect in. So I worked with a large academic center in Illinois that was extending Community Connect. I've worked with a medical center, a community-based medical center in Hawaii, and I currently work, if you go to the next slide, in Hennepin County, Minnesota. We're the most populated county in Minnesota, and we have a very active human services and public health component of Hennepin County. We also have Hennepin Healthcare, who I'm employed by, and Hennepin Healthcare and Hennepin County partner together, and we share an Epic record. And so if you are seen, if people are seen in public health, in corrections facilities, in many different care settings within Hennepin County, that's all the same record as the hospital, the clinics, public health department, health plan. We're all kind of sharing that same Epic record. So we can go on to the next slide. What is Community Connect? I'm sure you've heard a lot about it, or you've heard a little bit about it, or you've heard the term Community Connect or Epic thrown around. So to me, I think one definition of Community Connect is that it's one single patient record or one single file, digital file, that can cross many different care settings. And I think, Epic was founded in 1979 and it's evolved a lot since that time. But if you look at Epic over the years, it really started in this more, hospital scheduling or clinic scheduling and hospital-based. And as we've seen it grow over the years, it really has extended out into the community to not only clinics, but also nursing homes, rehabilitation facilities, prisons and correctional facilities, many, many different care settings or social service settings. So one definition is just a single patient record across many different places. We can go on to the next slide. Another definition is just very, very literal. I'm a very, very literal person. So Epic is software. So it can be used for scheduling, for billing, for patient care. When you think about things like medications and orders, I'm sure there's many people on here that are seen by an Epic organization. So when you go to the doctors and they are entering your medications, or you're picking up a prescription, or you're logging in to see your recent test results, you might be using an Epic product. There's also referrals. I know one of the things that when Anna and Susan and I were prepping for this call that they mentioned was that a lot of organizations are really interested in referrals and closing the loop. This is, I think, a big advantage of Epic. You can track things like referring department, referring provider, acuity, different needs, and types of people that need referrals. So that's another piece of this software. And I think if you look at the last, especially 5 years, we've really seen Epic shift into the social services arena as well. And so there's many different organizations that are capturing things like food insecurity, housing insecurity, social support network, transportation, substance abuse, and mental health information, all within Epic. And I think Epic has developed products to accommodate that. And I think there's also a lot of different organizations, and I'm sure you all are part of some of them, that are developing different data initiatives that are tracking some of this information, whether it's in Epic, outside of Epic, or anything like that. We can go on to the next slide. And then the more abstract definition that I think of as Epic Connect is it's a collaboration tool. So I'll just kind of go into a little bit of my current setup. So I work, and I know there's some folks from Minnesota on the line, so I work within Hennepin County. So Hennepin Healthcare and Hennepin County are all on the same Epic record. And because of that, we have a lot of different opportunities that we've identified over the years. We've been doing this for almost 10 years. If you look at the very first site we brought live, we've identified a lot of areas for potential collaboration that I don't think we would have identified if we weren't sharing the same Epic record. So it's pretty interesting. Sometimes it's cart before horse, and we don't really know, where to start. But it's really led to a lot of different discoveries, and those discoveries have driven collaboration. So I'll just give one brief example. We have a team of social service navigators that help people with everything from assistance applications, housing navigation, and things like that, that they do a lot of care coordination and outreach. Whenever people, this team that they're working with, whenever their roster, anyone from their roster is admitted to the hospital, we have that team of social service navigators that can actually come to the hospital and, with the patient consent, of course, actually provide that care coordination service to them while they're on site at the hospital. And so we can just take advantage of many different just convenience factors to help that person so that when they're discharged from the hospital, they have things like their housing and food kind of taken care of. So that's just one small example, but one of the drivers for that was our collaboration. One of the drivers of our collaboration is the fact that we're on the same medical record. And that could have happened, we could have facilitated that without being on the same medical record, but that was one of the things that we discovered and began to do. And we've seen some really great success, both with, satisfaction and outcomes, if you look at things like readmissions and things like that. You can go on to the next slide. And I'm keeping this all pretty high level, and then I'm hoping we can get into some specific nitty-gritties in the questions. So here's another example of where I think Community Connect is a really helpful tool. Let's say you have a client that has never been seen in the hospital or the associated clinics before, but they have been seen at a site that was using Epic Community Connect. So maybe it was their local doctor's office, maybe they had a stay in a rehab facility or nursing home or something like that. Let's say that they have a medical event and they're taken to the emergency room and they're unable to provide detailed information about their medical history. If those organizations that they had been to were on Epic Community Connect, Epic would have that information. They would have the allergies, the medications, would have that detailed information. And that very serious medical event would now have a lot more information. The providers and the care teams have a lot more information to go on rather than, John Doe presenting and you don't know their medical history, their allergies, their medications, and things like that. So that's one example of where being on the same medical record can just be huge. Obviously, there's also tons of population health and data advantages that you can have from being on the same record. But here's just, a simple patient example. We can go on to the next one. This is an example from my current organization. So we, as I mentioned, our public health department uses Epic. And so we've got a respite program in one of our healthcare for the homeless sites. We noticed that certain people, when they were being discharged from the hospital, there was a handoff to get them a bed in the shelter system for the respite program. But there wasn't really a medical handoff. So for example, we weren't communicating well about the medications that a person was on or about their specific needs, what they could do with assistance, what they could do independently, if they were able to be in a room with certain people, if they had to be isolated, all of those pieces. We were really just kind of worrying about getting them a bed. There was really no clinical handoff. And so we used the technology system to develop more of like a warm handoff so that when someone was being discharged from one site that had Epic to another site that had Epic, they actually have those clinical details and the people that are receiving the patients can get that important information so they can really take the best care of the patient. Okay, let's go on to the next part. So I've been talking a lot about the benefits of Community Connect, but I also just want to be really transparent. From my experience, there's also a lot of challenges, I think, anytime you're extending one software system, from one entity to another. And so these are some of the things that I have learned painfully over the years that I want to impart to you so that you'll have this as you kind of approach your discussion. So one, I think, is just kind of starting with the why and understanding more about, so I'm guessing from what we've kind of talked about previously, that you have some organizations in your market or in your area that may be interested in extending Epic Community Connect, and you might be part of discussions to figure out if that's a good idea or what the options are, things like that. So I think one really key thing to start with is just kind of like why for both organizations. So I know different markets have kind of different reasons that they'd want to extend. So I know like there's certain areas where maybe the population is a little more remote or less populous, where it's really important just from a care perspective. They want to extend to as many places as possible to make sure that there's information on people when they show up to major medical centers or things like that. There's other markets where organizations say, we really only want to work with our really close partners. And if we have a lot of crossover, those are the people that we want to extend our Epic record to. And there's all different reasons why an organization might decide to do Community Connect. I think there's accountable care organizations, HIEs. I know we've got some HIE folks on the phone. There's lots of reasons why you might want to extend. And I would just encourage you to think through not only why do you want to extend right now at this moment, but also 1, 5, and 10 years down the road. Where does this fit into your organizational strategy to be on the same software product? Number 2, I would encourage you to think about and rely on the people that you're working with to understand the costs. Typically, there's a significant upfront investment to get on Epic and then ongoing. And I know there's a lot of grants available sometimes for the initial, but then also thinking about long-term, how are you staffing that? Who's supporting that long-term software relationship, both at your site and at the site that's extending to you? So there's many different costs that go into Epic. So there are costs that you pay to Epic specifically, and then there are also costs associated with using the Epic product. So for example, a lot of organizations use a product called Citrix. Citrix allows you to get on to connect to Epic. So you've got costs you pay to Epic, you've got costs you pay to Citrix, there's Microsoft licenses, there's many different costs that go into this. And those costs are going to look different throughout the years. And I think it's good to just kind of have that initial understanding of what it's going to be, because I think in a lot of my past experiences, if you've never implemented such a complex software system before, I would say that Epic, based on my experience in the tech industry, I think Epic is one of the more complicated softwares that is kind of very configurable, very update intensive. So there's quarterly releases that come out with new functionality. It is pretty resource intensive. So if you look at the spectrum of things, you're probably going to need a team to kind of staff this and provide this information. So I think that that's one thing to keep in mind too, is a lot of the times in my past experience, if you've never done a type of implementation like this before, there's a tendency to underestimate those long-term costs and think, well, it's a big upfront commitment, but then down the line, it's going to, there's going to be an ROI. That may well be true, but I think it's really important to also think about what are those potential, soft costs as well. And that leads into my third point, which is the staffing model. So I think I would ask a lot, if I were you all, I would ask a lot of questions about, who's kind of my team, and if I need support, is that something that you provide, or do I need to, develop a team to provide that support? And what happens if there's changes? Just kind of all of that. In my current position, I've been here a little over 3 years. And so the relationship has existed for almost 10, and we didn't have a carved out devoted team for a majority of those, first 7 years. And that was a big lesson learned for the organization, is that we really needed staff to develop and nurture that relationship. And we've gotten some really positive feedback. So it's not just me, there's a team of really 6 of us that are working with our Community Connect partners now. And we've gotten a lot of great feedback that having that dedicated model is really valuable, because we're able to actually get a lot of value out of the system. We're able to partner together and come up with ideas that and execute on ideas, whereas previously it was a little bit siloed work. And then finally, I would ask a lot of questions about product mix. So as I mentioned, Epic has a lot of different product offerings, and I would ask what the partner in your market is offering. So there's, depending on what your organization does, Epic could be your new source of truth, your new record system, and that's a pretty big lift. So changing from your current system to Epic, that's going to be a really big change. and it's going to require a lot of change management and staffing and training and all those pieces. And also, depending on the type of work you do that's core to your business, there might be challenges to implementing Epic, which is mostly designed for healthcare, into your setting. So like, for example, I've been tasked over the years with implementing Epic in some, more interesting, I would say, edge case places. And, a school, for example, Epic isn't really designed for a school. And so as you're trying to implement Epic, there might be things that you have to say, oh, we can't do this. And so I just want to be upfront that there may be things that Epic is really, really good at that aren't really applicable to your business. And there may be things that are core to your business that Epic maybe isn't the best at. And so I think as you're weighing your decision, it's really important to understand what are the most important things to you, and what is that kind of product mix that you're getting from Epic. On the other end of the spectrum, Epic also has these more, I'm going to call them lighter weight products, where they have some newer web-based products. And I'm not using these in my current organization, but we're very interested in these as Epic releases them and tells us more about them. We do want to understand, potential costs of that, but that would be a more web-based product where you log in and still have the same connection opportunity, but you wouldn't necessarily need to completely change your software program. So, for example, in Hennepin County, we do have a partnership around Epic, but we have some people that are double documenting. So we have people that still have social service systems that they need to document in, and then they're also using Epic because we've found that that's really valuable. But I think we can all recognize that that's not super ideal for a staff to have to document in two systems. Okay, I'm going to move on to the last slide before questions. And these are kind of my takeaways, I would say. So I think that the elements for success are, one, starting with the relationship. So really making sure that you and your partner are on the same page. Do you have, let's say you have 75% of your patients are seen at the hospital. That kind of seems like a slam dunk, right? But then what are you going to do about that relation? How is Epic going to facilitate you reaching your goals? And what are you both, kind of bringing to the table in this relationship? So I think starting with the relationship is really key, and seeing how you work together. I know that it can definitely be tough when you have your own set of priorities, organizational priorities and goals, and then the hospital might also have their set of organizational priorities and goals, and how do you work together? So I think that's really key, and seeing how that works just in the initial phase is really important, because that's going to be how it's going to be, long-term as well. Two, I would say leverage your data as much as possible. So perhaps you don't know what your crossover population is. Use that and leverage your partner and ask your partner for as much data as possible. I know a lot of people are interested in referrals. There might be a way to use your existing system or use Epic to kind of understand what those referral patterns are, and that can also help drive, how you collaborate together. Define the scope. So again, what products are you interested in? Are you changing your whole billing system? Are you just interested in patient care? Who's going to be working in Epic? Who's not going to be working in Epic? How does all that work? All of those pieces. Four, I would say find a sustainable finance mechanism, or just start to think about how you're going to sustain this, not just the initial, but also ongoing. And then finally, governance. So Epic is, as I said, highly configurable. There's so many opportunities for customization and things like that. And so I know many organizations will say, our Connect strategy is one size fits all, and there's really not an opportunity for collaboration. And then there's other organizations that say there are limited opportunities for customization, but you have to kind of go through this process, and they call it the governance process, and they have different pieces there. So I would ask questions like, how do we make changes once we're live? Or, we have this annual report that's really critical to our funding, and we're going to need, annual changes on it. So that's an example that we have. We have some federally qualified health centers. they have an annual report that they need, UDS reporting, and there are changes every single year to this report. And so every year we make sure that we carve out, we know that we're going to have to spend some resource time making these changes to this report, because that's really critical to their business. They have to get that done. If they don't, they could lose potentially funding. And so that's something that we just need to do every year. So I'd ask those questions about, what happens when we want new things? How does it work? Who pays for it? what does that process look like? Okay, so I sped through those. I think now we can open it up to the questions.
Hi, Elise. So we definitely have some questions that have come in, which I posted in the chat just so that everybody can follow along. To start, we have two questions from Nikki in Western New York. Can organizations bill off Epic, and does Epic have modules for documenting evidence-based workshops such as chronic disease, diabetes, etc.?
Thank you. So I'm going to say yes, asterisk to both of those. So yes, Epic does have a billing software. I think I would look really closely at what your organization does and how you bill, and then what Epic offers, because I think Epic is definitely designed, the Epic billing is definitely designed for more traditional healthcare billing, so clinics, hospitals, urgent cares, things like that. And I know in the past, when I've worked with certain other agencies and other organizations that aren't strictly that more traditional clinic, hospital setting, there have been challenges. So Epic definitely has capabilities for billing work queues and sending patient statements and claims and pieces like that. But there's also, I think, maybe a limit to how flexible it is. And so if your organization is not not a clinic, not a hospital, I would ask a lot of questions about how Epic works at your partner organization to make sure that it has everything that you need for billing, because it does offer a lot, but I think there's challenges as well. And then in terms of evidence-based workshops, so I know that there are definitely ways to document chronic disease, diabetes prevention. There's many ways to document all of these different things, but each organization has a little bit different setup of Epic. So I would ask to make sure that your organization that you're potentially partnering with has those pieces, because I think some organizations are still rolling those things out. But Epic is pretty flexible in terms of what you're able to document, and they're also pretty good about pushing out the latest regulatory pieces.
Great. So the next question is from Brandon, who's in Maryland. And he was asking, is the software something we could have to be able to host ourselves on site, or is it available through a web portal?
Yeah, that is a great question. And I will probably I'll say a little piece and then I'll ask Danielle for help. So my understanding is that, so at my organization, we're using what I'm going to call the full Epic, or, Epic's Community Connect offering. So we have pieces of Epic that are hosted locally on our servers, and then we have our end users access it through a program called Citrix. But then Epic is starting to release more web-based. So there's a web-based product called Epicare Link that we have some of our community partners that use that web-based system. So I think Epic has different options, but there is one version that is more of a locally, I don't know if I would say hosted, but there's more local work to do. And Danielle, maybe you can help me say that eloquently.
Sure. So this is where it's kind of like we mentioned before that that's where it gets a little complicated, because that's where it requires communication with the healthcare system that is providing Epic to the community-based organizations. So you definitely can host certain components to this software, but from my personal experience, if you were to already get something through Connect, it's usually hosted, the major part of it is usually hosted by the bigger healthcare organization. There may be some requirements, little web servers or other components that is required to be hosted on site, but that's, again, is a conversation that needs to be had between you and the health system.
Thank you.
Perfect. So the next set of questions are specifically around, how community-based organizations can connect. So questions from Paul in Indiana. He kind of has two questions, but they're related, just the way to reframe it. So Epic appears to have an open API that CBOs can request access to. Do you have any tips or suggestions on how to approach health systems? So CBOs are already contracted with to access the open API. So is there a way that CBOs can feed their data, like send their data into a data lake or a data warehouse, rather than subscribing to Epic and waiting for the health system to respond to their request? And Paul, if I didn't quite get that right and you want us to take you off mute, if you're in a good place to talk, we're happy to do that too, so you can clarify your question.
That's a great question. I don't feel like I have a lot of ideas on that, except just, I think, this is a great resource. I know we've made connections with other health systems already, or not health systems, with CBOs already, that, looking at the all-in forums, trying to see like who's doing the type of work that you're interested in. So that's, I think I would say networking, any networking pieces that you're already in place with, try to use those to find people that are interested in the same stuff you are. I know that Epic also has, I don't know anything about this, so I'll caveat it with that, but I saw on Epic's website that they now have event called user group meeting. So Epic has a big user group meeting every year. So that would be one, potential. If you are partnering with an Epic organization, you could, see if they're going there and if there's other people that are interested in what you're interested in. And then they also have something called an user group meeting for organizations that don't use Epic. So I have no idea if either of those would meet your need, but just I don't really have any good tips of how to connect with people that are already kind of have access to the open API. Jin Yao, do you have any other ideas?
I think I would like to have some clarifications from Paul, if that's possible. Or, are you referring to any specific API that you found on the website? So then we can better help you, if that makes sense.
Paul, we're going to take you off mute so that you can add a little bit of detail.
Great, yeah, thank you. I know it's kind of a two-part question. So a lot of the CBOs we interact with, they have these healthcare contracts, and one of the main barriers is the Epic staff that the health system has hired. There's the cost barrier sometimes, but more often than not, it's they don't want to dedicate the technical time to actually make the connection work. So we can do that. I mean, we can build out the API and maintain it and set up these different formats and that type of thing. But I guess what we run into is they don't necessarily need a subscription to Epic because they're not necessarily entering clinical data or something like that. So we're looking to pull data into a data lake that the community-based organization has, almost like a health information exchange type of process. And then the community-based organization is kind of like custom assessments or something that they could possibly feed back into Epic that the health system would probably find valuable. So I guess I just didn't know if we have these resources for like the APIs that Epic talks about. But what's the best way to communicate, like, hey, the CBOs don't necessarily need a full-blown subscription model to use your application, but we can definitely exchange data if they're willing to. Does that make sense? Kind of?
Yeah, that does make sense. Oh, go ahead.
Yeah. No, you go ahead.
I was just going to say that, thank you for that context. That's really helpful. I think that in that case, as much data as you have or can pull together about kind of the why and like the, the potential, kind of going back to that relationship piece and the aligned goals, because I think, I'm just thinking about our perspective. We've got many requests in our, I think very similar in our county partners, that they want to integrate with many different products that can integrate with Epic. And I think the hospital is oftentimes dealing with, just increasing regulatory scrutiny and trying to keep Epic, right now my hospital is just trying to keep up with Epic's release cadence, because they just switched to 4 times per year, whereas previously it was like once every 12 to 18 months. And so as the hospital is kind of trying to spread like you mentioned about the resources, it'd be great if you could come to them with a business case of here's the value of this open API. And if you had a grant behind that or, something like that, I think at least from my hospital, those are the things that we're now putting our resource, time, and attention to, which easier said than done, right? But I guess that would be my advice, is just as much data as you can get about here's why this API over every other API that they could, that they're getting requests for. I think that would set you apart from the others.
So to add to that, I have worked with health organizations that have a really intelligent team of developers and people who can actually code against whatever they want to do. It's a really it sounds great. It sounds like a great idea, but from my experience, there has always been more work than what you would expect it to be. Like Elsie said, sorry, I'm butchering her name. Like she said that before, that because of the updates, because of the new things that comes out even more regularly now, every time anything updates, it could break whatever you're building or you've built to communicate with Epic. So, just keep in mind that that's could be what your future looks like if you decide to go down that route.
Yeah, and we look at a narrow data.
Go ahead, Paul.
Oh no, yeah, that's okay. And we typically purposely look for like a pretty narrow data set to minimize the maintenance as much as possible. But these are both great responses. Thank you.
And I had a clarifying question or follow-up question to that. Elise, have you seen any examples where, because you said, why this API over any other, given the number of requests that are coming to the hospital, have you seen any examples where like CBOs are coming together as a network? Because a lot of the groups that are participating in this learning collaborative already work as a network. Does that kind of bump them up the list in terms of getting the buy-in from the hospital?
I don't have any direct experience with that example, because I think Hennepin County is kind of unique with how we're all kind of Hennepin County, but we're not. So I don't have direct experience with that, but I definitely think that would be beneficial. The way that we kind of approach problem solving at our organization, I think if there were a group of individuals or groups that were banded together and already had, you've already have your collaboration in place and you already have a lot of these pieces, I think that would definitely make a big difference. And I think the more you can, I think that would just only add to that business case. And yeah, I would just echo that. It is, like as Danielle said, it is usually easier said than done. So the more that you can back that up with, here's how this is really in our best interest long term for both the hospital and the CBOs, I think that only adds to so like our organization, one of the things that we're really looking into now is housing insecurity. And so that is something that we are kind of doubling down on, that we are kind of putting all efforts into figuring out how we can work better together with our housing partners, both data that we have currently in EPIC and data that's outside of EPIC, and we haven't quite figured that out yet. But housing right now is kind of the most important priority to us. And so if there was a group of housing CBOs that had banded together and kind of had an idea of what they want, how it would be, sustained, and what the drivers were, I think that would be huge.
Great, thank you. So the other CBO question came in from Sue, who was also in Maryland. She says, in your experience, if a healthcare system already has EPIC and plans to implement Community Connect, do you think there would be an extra charge to CBOs for joining?
Sure, that's a good question. So I think it really depends what the CBO will be getting. So if the CBO is going to get EPIC as their source of truth, and as we kind of talked about before, that might not be possible for depending on what your CBO does. But if the organization is going to get EPIC and get the scheduling and the billing and the patient care platform, then almost everywhere I've seen would charge something for that. Some places subsidize it. Other places just kind of do a straight pass-through model for cost. But if your CBO is going to get like one of those web-based products I talked about, it really depends on the organization. Some organizations charge like a small fee for that, and then some organizations don't charge a fee for that. So it really depends on what product you're getting, and I think that the organization you're working with, that the healthcare system that's extending, they would be able to talk through all those specifics, because in my experience, every organization does it pretty differently, and it also depends on local regulations too. There's like the stark fair market value. There's some legislation around you can't completely subsidize it, but then there's other lower cost or completely free options too. Really depends on the system.
Great, thank you, Elise. That's the last set of questions that have come in. I want to just give everyone another opportunity to submit your question in the chat, or we can unmute your line as well. This has been really helpful, and I know that other vendors are dipping into the similar space, so probably a lot of this presentation is relevant to some of the other big EMR vendors as well. Does anyone else have questions? Janelle, did you have any other comments or reflections that you wanted to share?
So I guess one thing, just to echo what Elise said earlier, is that communication is really key when it comes to, dipping into the Community Connect world, especially on the technical end as well, because there could be a lot of charges that you don't foresee, or a lot of things that was unsaid during the initial planning period. So that's one thing that has burned most organizations that I've worked with prior. So just wanted to make sure that that's said here.
Yeah, thank you. That's really important information. Great. Well, thanks again, Janelle and Elise, for making your time available this afternoon. I hope this was helpful and clarifying to those of you that were really interested in learning a little bit more about EPIC Community Connect, and we will post the slides and the recording in the online community so you have access to them if you wish to share them with any of your colleagues. So thanks again, everyone. And if you didn't see my email, you should have received a save the date for, I believe, December 3rd and 4th for an in-person meeting with N4a in Washington, D.C. Some more to come from them about that, but we look forward to meeting you all in person at the end of the year. So have a good weekend, and we'll talk soon.